medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Today I'm going to compare and contrast basically creams versus pellets, their advantages and disadvantages. Now, everyone who does hormone replacement therapy has that question to answer when it comes to taking care of a patient. So I'm going to try to give you a primer of that in this small version, and hopefully this will help you from a clinical perspective. Hey everybody, I'm Dr. Mitch Ghen. So here's goes. What is the easiest? The truth is the easiest happens to be a pellet. A pellet has the advantage of once you put it in, it releases over the course of somewhere from 4 months to 6 months. If you want to be exact, each pellet releases about a 0.5 milligram a day. So if you place, let's say, 100 milligram pellet of testosterone, you have 200 days. But, there's a but, this is not physiologic. Physiologic time is different than the actual time that it will last. Now, why does that happen? Because if you have, let's say, a range of testosterone in the normal range from here to here, and someone's in the low range and you bring them way up to the higher end of the range, when they get to about the middle section, so to speak, they're not going to feel as good because you've changed the benchmark on this person. Yes, it's been studied, and there are studies that does suggest that as well. So the pellet's the easiest. Probably most people somewhere between 4 and 6 months. I find women tend to last a little longer. That would be helpful. So which one is the most physiologic? Well, it is true that both are basically bioidentical, and we're going to talk about that in a moment. But you're going to find that the most physiologic happens to be a pellet. When you put a pellet in, it is the only process in the hormone replacement market that uses zero order kinetics, meaning the body will take it as it requires. It doesn't go and irritate the liver, and it's a smooth curve throughout the time and duration of that pellet, which will eventually disappear. So is the cost equal? Well, there may be a slightly less cost to using a cream, whereas in the pellet component, it's probably maybe a little bit more expensive. Again, benefit versus risk for that particular individual patient. Both, as I said, are bioidentical and natural. Both of them come and are made typically from yam, just sources making them natural. So here are some of the failures with a cream, for example. First of all, you've got to put a cream on every day because you're going to get this type of dynamics. It's going to go up and it's going to go down every day. Yeah, there'll be some steady state, but it will go up and down. You could have a situation where that individual is a poor absorber. When you use anything, for example, that goes through the skin, there are about 20% of folks that don't have a good transcutaneous route that works for them. You could actually transfer this cream, if it's not done properly or put under a shirt or something like that, to the partner or to a child. So that has a disadvantage as well. The benefits, of course, it's easier to change dosages. If you look at a cream, if you give, for example, 1 pump, it's not enough. You can always increase it. If you give too much, you can always decrease it to a 0.5 pump, etc. And it's easy to call the compounding pharmacist and change it. Well, what about the potential pellet problems? Well, they could be painful. When you put pellets in, for some reason, if they're not put in subcutaneously, inappropriately, too low, or in the wrong area, they can be painful. You can't take them out. You just can't take a pellet out. Once you put it in, yeah, you could cut around the route which you're putting in, but because the trocar is a good 3 inches or so long, you'd have to go find that pellet to remove it. So it's best not to do that. You do risk infection. Any procedure that's somewhat, and this is minimally invasive, of course, does lend itself to a potential of infection and even to sterile abscess. You can also have pellets turn up on their side if they're not laying in the fascia right, which could cause pain and might need some manipulation by your hand to put them back down. Now, is the dosage that you choose good enough for what you do? I know there are companies that try to put tables out. For this, you should do that. For that, you should do this. I'm sorry, they don't really work that well. You have to get used to doing it your gut, your clinical acumen, you'll know which dose typically works. Obviously, a male uses a lot more of milligram strength, and for example, men are at least 10 times more requirement for testosterone replacement depending on their levels versus a female who is about, 10th of that in general. Too much, of course, in either case will run certain side effect problems. The same difficulties or problems with testosterone in general pretty much affect either whether it's a pellet or it's a cream. So, which one's better? Well, in my opinion, the pellet's better for one good reason. It's less of a bother for patients. As you know, patients are compliant maybe in the beginning, rubbing cream on every day, having to change the area, because if you put the cream hormone in a fatty area every single day, you are going to get it not working well. That's the first thing. The other is the pellet, which is a smooth release. It's the only one with zero order kinetics. So 5 thumbs up basically for the pellet, 3 for the cream. Your choice as a clinician. For more information, write to me at drmitchghen.com. That's drmitchghen.com. Thank you so much for watching.